Welcome students for your upper elective session. The course title is First Aid for All. In this session, we will be trying to cover the subunit 1.3 and 1.4, where we'll be taking care of all those elements that are required for the first aid, and we will try to see its importance for each one of them. So let's begin with learning outcomes of this particular session. At the end, you will be able to understand what all things are important in the first aid and what all instrumentation we have to keep, what all are the other things and varieties of instruments that we have to keep in the first aid box. And also to know a very important segment is the examination of the vital signs. So these all you will come in contact once you finish this particular session. Let's now understand where all we can find this particular first aid. First aid box can come in very much handy if you try to keep in very public places like companies, hostels, public areas. So there or it's very mandatory to keep the first aid box tagged and up to date. So first and foremost, the first aid kit should be there in your houses as well as in your car. So it comes in very easy access to us. So we should make sure our first aid kits are being installed in the particular areas as well as it is up to date. There are some things that we should make sure that it has been done when we are trying to maintain a first aid box kit. First and foremost thing is we have to include all our personal items inside that. For example, medications or any emergency phone numbers or the doctor's number inside that. So these are the very important aspect which has to be there in the first aid box. We have to check the regularly the kit, make sure whether the expired medications are being discarded and reapplied or uploaded by the new ones. We have to check all the other contents like any kind of sanitizers or the Dettol or any kind of savons. So these should not be expired. So we have to make sure the kit is up to date and it has been maintained properly. Let's come to an important aspect of this session, that is instrumentation in first aid box. So first of all, this particular instrumentation is given by the Red Cross Society. So they have recommended few of the items which has to be there if it is a family of 4. That is, first is the 2 absorbent compress dressing, that is should be 5 into 9 inches. So these all compressive dressings are being given for any kind of a bleeding aspects, which I will be showing you the diagrams or the pictures in the upcoming slide. Second is the 25 adhesive bandages. So you should make sure the bandages are being available inside the first aid kits, 25 in numbers. One adhesive cloth tape, 10 yard into in 1 inch. So this has to be there just because if we are running out of the cotton gouges, so we can use an alternative as a cloth tape. 5 antibiotic ointment package just to make sure the infections are being limited. 5 antiseptic wipes packet. These are very important if a child is fell down or they and have an open wound, if it is bleeding up, so we can use the antiseptic wipe packets from that, and we will be able to take off all kind of infections or the mud or the stones from the area, and we can make it antiseptic. Second is say 2 packets of the aspirin. This is very important. It's as in it is a NSAIDs, which we usually say in pharmacology. We usually use it to depress the inflammation. So these are the first few important aspects which has to be there in the first aid kit. As you can see, this back one is the yellow colored one are the adhesive bandage. We can even say that it can be in rigid as well as it can be in a flexible one. So usually we give this for varieties of things, just to keep the joint or the place immobilized, or if it is a flexible one, just to give a functional movement only. These are the cloth tape, which are very delicate, and they are called as micropore. So usually we keep these things just to make sure the bandages are being adjusted quite easily. This is antiseptic wipes, if you can see on the extreme right side. So these are the aspects which we can use once if a child is fall down on the road, when the or wound will be open and they will be having a bleeding over there. So at that type of moment, we can use this antiseptic wipes just to remove all the dirt from that area, and also to make the area septic free. The remaining areas are 13-inch of gauze roll or the bandage. So this also we usually need for any kind of a sprain or any kind of a fall. If you have any kind of problem with your ankle or even if your wrist, we can use this. One roller bandage. These are the different types of bandages that we can use. This is one 4 inches wide and this is 13 inches wide. So both are in different size and shape. So if it is a larger area, you can use for the bigger joints, and if it is a smaller one, we can use for the smaller joints. 5.3 inches to 3 inches sterile gauge pads. So these inches are usually given for the areas like if you have a gunshot wound or a stab injury, we can use those gauge pads on the areas and apply pressure on it so that we can stop the bleeding. These are also comes under the same thing. Next is oral thermometer, which is very important just to measure the temperature, even for useful for the kids as well. Two triangular bandages. This is nothing but to give assistance to your shoulder immobilization. So when if we have a shoulder pain, for the quick first aid thing, we can use a triangular bandage. One is tweezer. I will be showing the importance of it as well. For that, for example, if we have been bite with an insect or a thorn has gone inside. So the tweezer will be helping that particular thing. We can just keep it up, press it up and take that particular stick from our hand or wherever it is being buried inside. One breathing barrier. This is a one-way barrier where we usually give mouth-to-mouth breathing. For make it a safer way, we usually use the breathing barrier. So I will be showing the pictures for that as well in the coming up slides. This is the gauge roll. So here we can even keep it in the spiral form. Otherwise we can just cut it short and keep it in a square shape as well by keeping it in a very bind to bind step by step. We can just keep it up in that way as well. This is the triangular bandage as I told you, which can be used for the shoulder immobilization. And this is the oral thermometer, as everyone knows, just because it's a mercury one for using to measure the temperature. This was all about the what are the instrumentations that we have to keep it in our first aid kit as per recommended by the Red Cross Society. As per if the family is of 4 people, so we have to follow these things if we are trying to maintain the particular aspect like this. Many things should be there inside the first aid kit and it has to be checked regularly. So in the next section, we will be trying to go to find out how to do a examination for the vital signs. Stay tuned. Examinations of vitals. These are the very important aspect of the human examinations. When a victim comes or the patient comes, we try to check for the first and foremost things are the four examination: blood pressure, temperature, heart rate, and one more is the respiratory rate. So these are the four vital signs of the human, which we have to check whether it is a road traffic accident or whether he or she has been admitted in the hospital, where with this the four particular aspect of the vitals has to be checked, which is very important. So what are vital signs? Vital signs are nothing but they are the routine procedure which determines the internal function of the body. The pulse rate, the respiratory rate, the blood pressure and the temperature. These all will together give what are the function of the body, how the body is doing internally. So these functions are important to be measured, and depending upon that we can read the status of the particular patient. Find out how we try to check this out. Pulse. Everyone have seen how we try to check the pulse. So most probably what are pulse? How the pulse are being generated. They are nothing but the blood flow which is created by the heart and it is going to our vessels. We know the arteries are there. So it rushes through the arteries and from there the contraction happens. That's what we call it as the pulse. So pulse is nothing but we just need to feel it. Okay, so we are usually feeling in the radial side of the wrist. That is nothing but towards your thumb side. Okay, so if you try to see your thumb and just try to come to the base of it, on that particular area we will be checking this particular radial artery or the pulses. So after palpating it or after feeling it up on the side of the wrist, we will feel it with our three fingers, that is your index, your middle finger and your ring finger. These three fingers have been used to check the pulse, because these three fingers will be having more sensation as compared to your thumb. So that's why it is very much necessary to make sure that you are using only these three fingers to check the pulse rate. These pictures will show you the various areas of the pulse point. So we can even find out in the superficial temporal area, that is this. So if you try to just feel the areas and feel the particular arteries over there, you can feel it with, again, with these three fingers. Try to feel it, you can feel the pulsating pulse over there. So that you can see, you can even feel in this external this area. Is it the maxillary area? Here also you will be able to feel the pulse. Carotid, this is very important, which you usually see in the movies as well. So if you are not finding any pulse to the distal, that is in your arm area or your elbow area, if you are not finding in these two areas, the third and important part is your carotid or the side of your neck. If you try to keep your hand over the side of the neck, you will be able to feel the pressure or the pulse here. Next is in your brachial. It is nothing but it's your elbow joint. So if you try to know where is elbow, just above that there will be a brachial artery. So if you try to palpate over there or feel over there, you will feel the pulsating thing. Next is your both the side you will be having the pulse. So basically we take only the radial side, that is near to your thumb side. That's what we will usually look forward for the wrist. Next is the femoral, that you can find it near your groin area, this area. If you try to palpate this area, we will be getting the one more pulse. Next is on behind to your knee joint. Behind your knee joint, if you see, there is a gap. We can feel it that same like the elbow we have in the knee as well. So we will try to see, just it is little bit deeper inside. It's not too much superficial or not too much ready to get it up very quickly. It's very deep inside, so it needs more pressure to find the popliteal artery. And next is this is the again important part, that is the posterior tibial, where you have the inside of your foot. This side, after you have seen one bone over there, behind that bone we can find one more artery. But basically for the legs and all, basically for the legs, we usually go for dorsalis pedis, which is given, which is on the front, where we can see our legs, all the segments we can palpate or feel and see. There in the mid, we will be finding this particular artery, and the pulse we can also get it from here as well. So the main important artery or the pulse that we can get it is from radial, that is on the side of your thumb. Next is the brachial, which is there in your elbow joint. The important part is the carotid, which is there on the side of your neck. And the least but is in the lower limb, which is dorsalis pedis artery. So if these are the arteries, and from there we can get this pulse. So just make a note of this, because these are very important aspects. Normal ranges of the pulse in the infants are 100 to 160 beats per minute. It's the BPM is nothing but beats per minute. Next is the children, that is 1 to 7 years old, and here you can find it 80 to 110 beats per minute. The children over 7 years, you can find it out 70 per 90 beats per minute, and in adults it is 60 to 90 beats per minute. To the respiratory rates. What is respiratory rate? Respiratory rate is nothing but the breaths per minute. So these are calculated as how many breaths you are taking in a minute. So that's, as per that, we are called it as respiratory rate. So normal range for the adults are 12 to 20 breaths per minute, but according to the age, it keeps on varying. For example, if the baby is less than 1 year old, the respiratory rate will be nothing but 30 to 40, because their ventilation is way too much. And if the baby is 1 to 2 year old, so the respiratory rate will come down to 25 to 35. If the baby is 2 to 5 year old, then it will come to 25 to 30. And if the kid is becoming toddler, has become now a bit teenager, so 5 to 12 years old, then it will go to 20 to 25 breaths per minute. And if the teenager is more than 12-year old, then it goes to 12 to 20. So these are the segregation that we have kept. So normally if the adult come into the hospital, or we are trying to check to each other as well, so it will come as 12 to 20 per beats per minute. Let's now talk about the blood pressure. Blood pressure, as we all know, it's very common thing for in everyday day-to-day life. We come across the word blood pressure. Blood pressures are nothing but the amount of pressure that we are exerting on the walls of the artery. So according to that, we will try to check what are the things. So here, blood for checking the blood pressure, as we know, we try to check with the handcuff. The cuff will be there. We will try to put it up with a stethoscope, and there will be an electrical one. So both of this we can be used to check the blood pressure. So here we try first. We can try it even to find out the pulsating with the help of the stethoscope, or even if the digital one is also available. So the choice is yours, which one you are trying to use it on. There are two types of blood pressures that we talk about here. Is one is systolic and one is diastolic. So systolics are nothing but which is coming up. So we, as we say, how you might have seen 90 per 120 is the blood pressure. So the 90 which comes up as a numerator is known as the systolic, and which comes in the denominator is the diastolic. So depending upon that, we have classified like normal, elevated, or high. So normal will be the less than 120 mmHg, and diastolic will be less than 180. So whatever comes in that particular zone are considered as normal. Elevated one will be nothing but 120 to 129 mmHg in the systolic one, and the diastolic one it is the 80 per mmHg. Less than that, it will remain the same. But in high, we try to consider that more than 150 mmHg is considered to be high in the systolic range, and in the diastolic we try to tell that it is more than 80 mmHg. So in this way we have been classified. It's a very simple classification that I have put forward for you to know what kind of blood pressures and what are the different types and what are the different variation of it. The next is temperature. Temperature, as we all know, that is the balance between the heat lost and heat produced in our body. So it is a very important thing and very common thing for everyone, because once in a while we have checked everyone's temperature. So we are using this to check the core body heat. So we can even use the thermometer for it, or with the physical touch we can even get to know the temperature, whether it is rise or whether it is very low. Now, in this slide, I will be explaining about what are the different methods of checking the temperature on different areas, and what are the normal range in aspect of the Fahrenheit as well as in the degree Celsius. So in the oral one route we directly maybe use for the people who are little bit cooperative, because if we are trying to administer this particular thing for a baby which is just 1 year old, then they won't be even cooperative. So that's why we have to keep it for people who are understanding our command. So that particular aspect, when we try to take the oral temperature, it should be the normal range should be 36.4 to 37.2 degrees Celsius, and in the Fahrenheit it will be 97.6 to 99.6 Fahrenheit. If it is in year, again we can use it for the kids as well. So here if we try to take it up, so here we try to put the normal range to 35.9 to 37.6 degrees Celsius, and in Fahrenheit it will be 96.6 to 99.7 Fahrenheit. Armpit, again it is again need a command to follow, so we generally don't give to the kids. If until they are very asleep, fast asleep, then we can administer the armpit method. The range for them will be 35.2 to 36.9 degrees Celsius, and 95.3 to 98.4 Fahrenheit. So this is for the armpit. Rectal is most exclusively for the babies only. So here we try to find it out. It is the normal range is 37.8 to 38.1 degrees Celsius, and 98.6 to 100.6 degree Fahrenheit. This is slightly increased because normally the kids' temperature is little bit higher. And forehead, as you have seen this particular object in most of the areas, in the malls, in the entry zone, so you can see everyone having this particular temperature taking machine, which is digital. So that particular range should be 35.8 to 36.9 degrees Celsius to this in Fahrenheit it will be 96.5 to 99.6. So this should be the range in the Fahrenheit. So now let's move to the variation of the temperature. In the variation of temperature, it's nothing but we have given there four different conditions. Hypothermia means the temperature of the body is relatively very low. Normal, where we have a normal amount of temperature. In fever or hypothermia, it's between little bit elevated than the normal one. And hyperpyrexia, pyrexia is nothing but the fever, where you have a high grade fever. So in hypothermia, the Celsius degree will be less than 35 degree. Whatever falls below it, we will try to call it as hypothermia. And in Fahrenheit, it will be 95.0 Fahrenheit. Normal degree, as we know, it is 36.5 to 37.5 degrees Celsius, and in Fahrenheit, it will be 97.7 to 99.5 degrees Fahrenheit. In fever or hypothermia, if the slight increase of the fever, there we can say it is either more than 37.5 or 38.3 degrees Celsius or 99.5 to 100.9 Fahrenheit. So if it is hyperparexia, so if it's a very high grade fever, we'll call it as more than 40 degree or 41.5 degrees Celsius or 100 or 104 to 106.7 Fahrenheit. So these are considered as high grade fever. I hope after this sessions you might have understood the instrumentation of the first aid, what all should be added according to the Red Cross Society for your family that you can administer or put it up in your house as well as in your car. And also how to do the examination of the vital signs. This you can even use in your daily life as well. Try to check it out what are the vital signs of each other and let's make it as a habit to check everyone's or even self. So it makes sure that you are away from all the diseases. Thank you so much student for this session. Let's meet for the next one. Will be with the unit 2. Thank you so much.